Hello, this is David Lee from Prevent Connect, and I'm really excited to have all of you joining us today for today's Prevent Connect web conference, the role of alcohol policies to prevent intimate partner violence and sexual violence perpetration. Prevent Connect is an online project committed to advancing the prevention of sexual violence and intimate partner violence. There's many ways you can participate with us. You have all gone to our website. You can email us. We have e-learning programs, which are great ways that you can be able to connect and get some of our content repurposed at any time and even get certificates for this. My colleague Ashley Mayer leads that project. We have a wiki, which is kind of like Wikipedia, but it's only on topics of prevention of sexual and domestic violence. We encourage you to do that. Also, friend us on Facebook, like us on Facebook, follow us on Twitter, and there's many other ways that you can get us, including YouTube. You even can get our podcasts on iTunes. Briefly, to use the technology, I know many of you are very familiar with this technology. The first thing I want you to do is to raise your hand. The way you raise your hand is you look above my picture on the far left-hand corner. There's a little hand that says My Status. Let's see how many of you can raise your hand right now. Thank you very much. Great. We've got 31 of you, 134, and this promises to be a very large session, so that's great to have so many of you joining us. Thank you much. I will lower hands. We will be asking for participation. One of the things that separates Prevent Connect web conferences from others is the great chatting that goes on. The chat, which is now on your, should be on the right-hand side of your screen. You can write a message by typing in there and clicking here. If you want to talk with other people in the web conference, go ahead and click on the private chat. Click on their name and you can talk to people privately. We do have copies of the slides available today for today's web conference, including links to the resources. We have full text of the articles available for free online, so I'm really pleased that that's available. And that if you want to get, and Ashley just posted the link to getting the slides, they are available. I do want to ask a few questions of the audience just to get a sense of who you are. And so I'm going to ask the first question. It should appear on your screen. Have you attended a web conference before today? Is this the first time you've ever been on a web conference at all? And go ahead and click on the screen. Have you attended a web conference today? Yes, but it's the first time you've been on a Prevent Connect one. Let us know if you're the first time on Prevent Connect or been on other web conferences. Or if you've been on web conferences before and have gone to one or two previous Prevent Connect ones, or if you are what we consider a regular and been to 3 or more Prevent Connect web conferences, go ahead and do that. I'm going to share the results. Not all of you have voted, but most of you have. Very good. We have 7% of you have never been on a web conference before, so welcome. And then another 25% of you have been on other web conferences for the first time on Prevent Connect. To 1/3 of our audience, welcome. We hope that you find this to be a useful web conference, not just in learning, but also connecting with the community of other people who are committed to these issues. We also have 27% of you have gone to 3 or more Prevent Connect web conferences. Thank you. There's many great voices who participate and help make this a really strong web conference. I'm going to withdraw that question and ask another question. I want to know what best describes your organization or agency. And and I know if you're for the audio problem, Ashley's going to say if you can't listen on the phone, we recommend you if you can't listen on the computer, call on the phone. It depends on your bandwidth, how good your audio is. But go ahead and write down what best describes your agency. I know you only can pick one. Go ahead and write down what type of organization you are. I'm going to share the results where we can see that the largest one are dual domestic violence or sexual assault agencies or coalitions. We also have a lot of people from colleges and universities at 12%, many from sexual assault agencies, domestic violence agencies. I also see people from state or territorial federal public health departments, people from community-based organizations, from alcohol and other drugs organizations, from criminal justice, and a few people that said other. So thank you so much for being able to share with this. So a few people have written down in the text chat what they are. I'm going to close the polling question now. We are on the phone. Your phones are muted, and most of our questions come through the text chat. We do have captioning available for today's web conference with our partners from Aberdeen Captioning, and you would go ahead and in the upper left-hand corner there is a CC if you're not able to see the closed captioning, and that is available for all people. We do this to make our sessions accessible. We do have some web conference guidelines. Our main point is to show good etiquette when participating. We want people to write in the text chat. That is valuable, but side conversation, please put into the private chat, and we'll be able to do that. If you need help, it's in a private text chat to all genders, and either Ashley or I will be able to support you. If you need help, a web conference service, call iLink Technical Support at 800-799-4510. That is 800-799-4510. Prevent Connect is a national project of the California Coalition Against Sexual Assault, sponsored by the U.S. Centers for Disease Control and Prevention. The views and information provided in this web conference do not necessarily represent the official views of the United States government, the CDC, or CalCASA. So with that, Prevent Connect, as I said, does talk about domestic violence and intimate partner violence and violence. We look at violence across the lifespan, from looking at children through elders. The Prevent is about preventing violence before it starts. We have a focus on primary prevention. You'll see a lot of our focus is often on perpetration prevention, as we'll be talking about today. And the Connect is connections to other forms of violence and oppression and social issues. And so today, as we talk about the connections to looking at alcohol, I think are very important. And that we also are about the connection to other prevention practitioners. To me, the success of Prevent Connect is often seen in how we learn from each other to improve the work that we are doing and build a community and a movement of people committed to ending domestic violence and sexual assault. We have a wide range of web conferences. You can see today's web conference in red. We've just had yesterday a fabulous web conference on supporting kitty culture as normative strategy for preventing sexual and domestic violence. We do have many web conferences coming up. There'll be a few more that we will be adding this year. This year's theme is making connections, honoring communities. We have recordings of all of our web conferences available, so I strongly encourage you to check out those. Join us at future web conferences. You do go ahead, sign up. We have a lot of people joining us, so it's great to have so many of you being involved and joining. So with this, I'm really proud to introduce today's session on the role of alcohol policies to prevent intimate partner violence and sexual violence perpetration. And this is a topic that I've been interested in Prevent Connect do for many years. I'm talking with Sarah Dew, who's unable to join us today, but I had taught her. She was doing some many years ago, looking at doing literature about alcohol policies, and felt this is a topic that would be important for all of us. The objectives for today is that we're going to be able to describe the challenges and address alcohol and sexual violence in partner violence efforts. Also, the opportunities that addressing alcohol policy provides for sexual violence and intimate partner violence prevention efforts, and we'll be able to, and that everyone will be able to identify the next action that they'll be able to take to address alcohol policy in their own prevention work. And once again, to reiterate that when we hear from our speakers today, the findings and conclusions in this review that they're referring to are those of the authors and do not necessarily represent the views of the Centers for Disease Control and Prevention. So, I can relate. You can use this phone? Are you called in? Oh. Hello, I'm sorry, we're trying to do audio. I'm improving my audio. Is this a bad audio? I'm going to have to ask people if the audio sounds better now. I'm going to put a little poll in the left-hand corner saying yes, go ahead and say yes if it's better. The audio sounds better now. I'm getting only a few people saying no, a lot of no's. It's not something. So I'm going to go change phones and get a new phone to come in. You need. Okay, so I can hang up on this one. Hello? Can you hear me? I should be coming in nice and clear. We are just fixing audio. I'm in a different office than I normally am in, so this is a new piece for me. Yay, I sound better. I apologize for that. So as I say, the findings and conclusions in the review that they're referring to are those of the authors and not necessarily represent the views of the Centers for Disease Control and Prevention. So I have a question for all of you. How, from your perspective and your knowledge, go ahead. How often is alcohol involved in sexual violence or domestic violence incidents? From your experience, what do you see? And I'm seeing here about half the time, at least, very often, a lot, most often, a lot. Someone gave a number, 85%, but I'm seeing a lot of most often, 45%, 75%, more than half, more than always, a lot. I know when I worked in the local domestic violence agency that we saw that there was a lot of alcohol involved. And I know in the local rape crisis centers that I work with that they report how often so many of the people are involved in this, and that it's how common it is to be able to see the that this is going on. And so it's something that's very common with us. And what we do see in the literature shows that there is a strong relationship. And I think it's important to recognize there's a relationship between alcohol and sexual violence and intimate partner violence. And I want to talk specifically about the perpetration. And that depending on the studies you look at, between 34 and 74% of sexual violence perpetrators used alcohol at the time of their assault. And that depending on the studies, as many as 2 out of 3 IPV victims reported that their assailant was drinking at the time. Now, notice we're talking actually about the perpetration. One of the reasons I don't want to talk about victimization, and we're going to get to in a moment, is talk about victims, but we also see some of those relationships that are being involved. So it's something that's here, and many people are doing this, and someone pointed out that's only the reported usage, and so there's a lot that we do not know about, that we know, but we know that it's very common. And so I think it's important for us to recognize this. And for the work that I've worked in this field, I know this is something that we all recognize, but we also are trying to figure out how we can best address it. Now the next question is, what is, in your opinion, the relationship between alcohol, intimate partner violence, and rape? So let's go over and use the text chat. Let's get the wisdom of the audience here and see what do you see as the relationship between alcohol and IPV, or the relationship between alcohol and rape. And this one might take a little bit longer for you to write because it's here. Carissa writes, strong correlation but not causation. I think that's a really important thing. And when we talk about a correlation, it's about that they're associated, that we see them both happening, but it doesn't necessarily mean that one causes the other. And so we see that. Some talk about alcohol lowers restraint and control, but also used as an excuse. It's not a cause. Some talk about a direct relationship, but not causation. Some people talk about inability to give consent, which is more around the victims, but it's also alcohol is the most used date rape drug, Samantha points out, that we see alcohol is used in order to, as an excuse, or also as doing this exacerbates but does not cause violence. So, and I see a lot about not being correlation, was used to incapacitate victims, and perpetrators use it as an excuse for their behavior. And once again, I'm seeing a lot of this. So actually, I'm noticing a lot of people giving very similar themes, and these are the themes that I've really learned in the work that I've done. Do you notice the same things, Ashley?
I do. I really am seeing that correlation does not equal causation, which I think is a reflection of just the expertise that's here in this virtual room today. And I really, I'm pleased to see that people are pointing out that it is often used as an excuse. That it does kind of, it's used to minimize the abuse and the things that, especially those of us who have worked in advocacy know, because we've seen that just so pervasively throughout our work in the past and today.
Now the other one, and I really think, and Elizabeth points out, it's also used to blame the victim, and it's often used to discredit victims. And so that's another dynamic. And I think I think if I'm right, my next slide is going to illustrate, so we'll get to that in a moment. So what are the challenges in talking about alcohol and intimate partner violence and sexual violence? What do you see the challenges to have this conversation? And
I think that one of the challenges is that we're worried when we bring them up that it's going to be able to lead to victim blaming. So what are these challenges? So I'd like to just get from you all, what do you see are the challenges in talking about alcohol? And I think one of the challenges sort of involved in what people were saying is that some people think that might mean that it implies that it is the causation, and so and that that it can become an excuse. And then the victim blaming, stigma. Elizabeth talks about if victims are underage, they fear legal trouble, and we see this often for college students who are, if they were drinking, that it's hard to be able to come forward because they might face sanctions for their alcohol use. There's denial, excuses perpetration because of victim use.
Right.
So it's a survival.
Mm-hmm. And David, this reminds me of why I even feel some hesitance around talking about this. I recently, a few years ago, went to speak on a college campus, and when I showed up, they had this great marquee with a picture of a cocktail and my name next to it and saying sexual assault, sexual assault presentation. So I think that is why there's a lot of maybe fear about talking about this, because as we've seen in the text chat, people say it just, gets taken to this whole other level that we never even meant to go to.
Yeah, and many people here have rights talking about the gendered nature of this, and I think as Paula writes it, if the survivor was intoxicated, she gets blamed, but the perpetrator is intoxicated, he's offered an excuse for his choice of violence. And then I think we look at the way that our gender lens that we look at, it's important. And Samantha raises a question. We don't want to take the focus away from primary prevention. Alcohol itself is the root problem. What I think we want to look at it and explore today is to think about how we can be able to think about policies around alcohol that actually can be ways that will change the environment, that will be aligning, I think, with some of our primary prevention pieces. And so once again, the gender is there. And then binge drinking is, of course, a whole other issue that we're seeing that's going to be that's involved, that we have to be able to contemplate as we see what's going on. So thank you so much for being able to do this. So we're seeing this. Now the concern, and Ashley, this is something that I've noticed, is that sometimes we see these challenges and that these are here, and sometimes people conflate the two issues together. And so even at a college campus, some college campuses might want to focus only on the drinking to be able to address sexual violence, and we don't want to be able to do that, but we also want to be able to find ways to get to those linkages. And so it's important that we recognize these challenges, make sure we do not fall into the traps and those limitations, but also make sure that we think about how we can be able to use this in the most effective way. And there's confusion around consent when we're beginning to talk about the alcohol. Now, one of the issues that we've often seen is this myth that alcohol is a cause of the violence. And I take this from a material that was substance abuse and women abused by male partners, a prevailing myth about domestic violence that alcohol and drugs are the major cause. In reality, some abusers rely on substance use and abuse as an excuse. Alcohol allows the abuser to justify his behavior as a result of the alcohol. And so this excuse is a common one that we see. Another piece that we have seen, and this is a notorious article that appeared in Slate a few years ago, and many of you probably have seen this, was that their rape prevention messages were telling women to stop getting drunk. And it was another way which is a very dangerous concept of holding women responsible for the prevention of rape. And so this is something that we see as an irresponsible way of approaching the issue. While not saying that there shouldn't be information to think about how we drink, if we think that this is the solution to addressing the issue of sexual assault, it's extremely problematic because we are holding those who are being victimized as being responsible for their situation. That is something that we have to be clear is not acceptable in how we approach our work. And so this victim blaming is very profound, and we don't want our prevention messages to become embedded and end up reinforcing the victim blaming. And so I see several people are commenting on this. So, Ashley, anything you want to add about, I know this was a pretty notorious article that in the blogosphere, it appeared in a blog, but yet got a lot of discussion and sort of highlights, I think, illustrates well this issue.
I think it does illustrate the wellness issue, and it reminds me, even for this web conference, I've gotten quite a few questions. Why are you even talking about alcohol and sexual violence in the same space? And I think that that gets to this, let's stop telling women that by not getting drunk, you're not going to be sexually assaulted. But I think that there's a place, and that's what we're going to do here today, there's a place to talk about this and to talk about the correlation and it being a factor but not a cause.
Great, thank you very much. So in this, what I want to do is think about this. And how many of you, okay, I'll do another yes-no one here's going to be a kind of an easy one. Yes, no. Are you familiar with either of these models? Go ahead, say yes, no in the left-hand corner. And I am guessing with our Prevent Connect audience, we are overwhelmingly yes. The left, of course, is the socio-ecological model, and the right is the spectrum of prevention. And, of course, we've been using both of these quite profoundly in Prevent Connect. What we want to do, and this is, to me, is an important part of our prevention work, is that while we recognize what happens in individual lives, we want to move from the individual to a broader, higher levels. From the socio-ecological model, I am trying to be able to move from the individual level and start thinking about how we can address this issue, particularly on the community and society level. Or on the spectrum of prevention, while we want to make sure we are strengthening individual knowledge and skills, we really want to think about how we can get to the place where we're using policy and legislation and changing organizational practices to be able to inform where we're going. Oh, I'm supposed to share the results. Thank you, Ashley. I forgot to do that. And indeed, overwhelmingly, people are familiar with these models here. And if you're not, I strongly recommend, Ashley will probably put you a few links in to get more to learn about these. We do have these use these often in our Prevent Connect ones. And so we want to be able to move from the individual to a policy level, move from an individual to a community or society level that we believe is a way that can strengthen the way that we can make changes in our environment to be able to prevent sexual violence or intimate partner violence. So with this, I am really pleased to have today two of our three people. Sarah helped develop this presentation and unfortunately is unable to join us today, but I'm really pleased that we're joined by two of her colleagues. We have Megan Kearns, who is with the Centers for Disease Control and Prevention. How you doing, Megan?
I'm doing well. Thanks, David. Thanks for having me.
Can you just get a little louder?
Sure. Is that a little bit better?
That's great, and it's wonderful, and we'll be talking about the work, and it's been a real pleasure talking with Megan and the work that she's been doing in intimate partner violence. And we also have Carrie Lippy, and Carrie, who you used to work at the Centers for Disease Control and Prevention, and now you are at the Northwest Network of Bisexual, Trans, Lesbian, Gay Survivors of Abuse. Hi, Carrie.
Hi, David. How are you doing?
Great. Wonderful to have you joining us, and I'm glad that you've been able to talk about this work that you did before, which I think still is relevant to the work you're doing now.
Thank you. Yeah, it's great to be back here at CDC with Megan, so I'm excited to talk about our project.
Great. Wonderful. So in this, there's two articles that have been recently published, and in Trauma, Violence, and Abuse, there is the article Exploring Alcohol Policy Approaches to Prevent Sexual Abuse Perpetration. This was published e-published in November 16th, 2014. We do have a link there. As I say, it's available, and Ashley just posted it. Oh, no, she just posted the SCM and the Spectrum of Prevention, the great document that's there. But we do have a link here. It's also on the Prevent Connect page. You can get a full text of the article, and so it's a really great base to do this. And that Carrie Lippy and Sarah DeGue had put together that article. And then also this January, in the Journal of Studies on Alcohol and Drugs, the article, The Role of Alcohol Policies in Preventing Intimate Partner Violence, a review of the literature was done, and that was authored by Megan Kearns, along with Dennis Reedy and Linda Ann Valley. And so these are two articles, and I'm going to actually go ahead and clear my answer here, because I am going to ask now, have you read either of these articles? So let's see who in the audience has actually read any of these articles. And we have, I know, written about these on Prevent Connect in our blog, and great, go ahead. It's wonderful seeing people going ahead and keep on voting. I still know that there's over a third of you that have not voted yet. I think I am sharing the results live. About 20% of you have read at least one of the articles, and 80% have not yet read the articles, but we encourage you to do that. But we're going to be summarizing them today, and you'll be able to get the information. In addition to the articles, our partners at the National Sexual Violence Resource Center have just put out, I believe yesterday, this report. In fact, I have Donna Greco from the National Sexual Violence Resource Center. If you can press *6 and unmute your phone, Donna, I'd love to have you just give us a 1-minute summary of what this is. I don't have your picture in this. I don't have your picture. Okay. You do not look like a gray figure, but.
Thank you, David. What you're seeing here is the cover of the research translation that the NSVRC was so excited to work on, along with the authors Caroline Lippy and Sarah DeGue. In this research translation, we synthesized the really important findings that you'll hear about today from the authors in exploring alcohol policy approaches to prevent sexual violence perpetration. And what we really tried to do in this resource that you're seeing is discuss some of the complexities that you all have already chatted about in the public text chat there, just the complexities surrounding alcohol and sexual violence, and then possible applications of these critical findings using policy as a prevention approach to sexual violence prevention.
Well, thank you, Donna. I think it's so important because it's important for us to have the research literature, and we have the work that Megan and Carrie are going to be talking about today from the research perspective. And it's also important to be able to translate, to have this available that's written in a little different language that's designed not as much for the academic audience but for the practitioner audience. And I really appreciate the work together. And it was great that National Sexual Violence Resource Center, Prevent Connect, and CDC have been collaborating together to try to get this all lined up together as these have been going on. And I know we've had a few meetings talking about this, so I'm really appreciate you getting it out there, and was thrilled to be able to see the resource that came out, and it is now available. And I guess you haven't even announced. Have you even announced it yet to the world, or is this the public unveiling?
This is the public unveiling, and thank you all so much for this opportunity to hear more from the authors. I know I'm just so excited to better understand these findings. So thank you.
Great. So with that, I'm going to hand the podium over now to Megan Kearns, and we're going to do this. And Megan is going to be presenting along with Carrie, and we'll be bouncing sort of back and forth. And so, Megan, it's a pleasure to have you. And so, why don't you talk about why using a policy approach to sexual violence and intimate partner violence prevention?
Okay, great. Thanks, David. And thanks again for hosting this webinar. We're excited to share what we've learned about alcohol policies today and have this conversation with everyone. Am I coming through loud enough?
If you can get a little bit closer, that'd be great.
Okay. Okay, so yeah, before we dive into the findings, we thought it would be helpful to take just a minute to talk about why we're exploring policy approaches to sexual violence and intimate partner violence prevention in the first place. And we know that there is a critical need in the field for prevention strategies that work at the community and societal levels, something that could be implemented as part of a comprehensive prevention plan. But we still know really very little about what might work at those levels to reduce rates of perpetration. So public or organizational policies are one way to create change at these levels. Policies are potentially useful because they can have broad impact with few resources, and they can modify behavior by changing aspects of the environment or social norms around a certain behavior or public health issue. And they can complement change at the individual and the relationship levels. So over the last few years, the Division of Violence Prevention at CDC has been interested in improving our understanding of what the science tells us about potential policy approaches for sexual violence and intimate partner violence. And because not much research at this level is available in the field, it really has been a challenge to do this work, but we're very excited that these two papers are now complete on alcohol policies. And we just wanted to note that while we're focusing on alcohol policy today, we hope that this is just the first step towards identifying policy and other community level approaches. So first step and hopefully not the last. So why start with alcohol policies? First, there's several reasons. First, compared to many other policy areas, alcohol policy approaches have been studied much more, and some policies have already shown impact on other forms of violence and related outcomes. So for example, alcohol policies have been shown to reduce rates of delinquency, physical assault, and homicide. And because those outcomes are linked to risk for sexual violence and intimate partner violence, it suggests some potential for alcohol policy to have an effect on these forms of violence perpetration as well. Many of you may have seen the Connecting the Dots publication, and we feel like that's a really important discussion of shared risk and protective factors, and how alcohol use is really one of the factors in that publication that cuts across all forms of violence. Second, the links between alcohol use, especially excessive alcohol use, and sexual violence and intimate partner violence perpetration has been pretty well established in the literature. So again, referring back to that statistic that David posted earlier, our sense is that about 3 out of 4 SV perpetrators and 2 out of 3 IPV perpetrators were using alcohol at the time of the assault. So this suggests that alcohol use may be one area where there's an opportunity for prevention and intervention. Although alcohol use is associated with victimization and policy approaches can affect everyone in the community, our focus here really is on how we can prevent perpetration. So
Carrie, why don't you go ahead and talk about how this might work, the alcohol policy with IPV and sexual violence prevention.
Sure, great. Thanks, David. So as we started these projects, we really wanted to unpack how these policies may be affecting sexual violence and intimate partner violence perpetration. And as many of you know, there's no shortage of theories to explain the links between alcohol and SV and IPV. But we ended up, through this project, sort of focusing on 2 potential mechanisms that we thought were the most likely to explain how alcohol policies may affect SV and IPV perpetration. The first that's up here now is probably the most familiar to folks. We have hypothesized that the alcohol policies may affect rates of violence by reducing excessive consumption, and thus the direct effects of alcohol and behavior. And again, there was a lot of thoughtful discussion in the chat about the effects maybe being direct, but really having to be understood that even the pharmacological effects of alcohol on cognition and behavior, things like disinhibition and reduced empathy and things like that, really have to be understood in the context of how they interact with all these other factors, including individuals' existing risk factors like their personality characteristics, their belief in rape myths, things like that, but then also these overarching sociocultural norms about alcohol, sex, and gender. That really the cultural norms have this huge impact on making meaning, and that affect the pharmacological effects to some extent or interact with them. And that there are cultural norms about the effects of alcohol. Someone, I think, in the chat talked about it being a social lubricant, or that it increases aggression. And so these social messages about what the effects of alcohol are can actually be seen as having an effect on people's behavior, even when they haven't consumed alcohol, but they think they have. There are laboratory studies that show that people will act aggressively or more socially, or have a social lubricant even when they haven't been drinking. And so these pharmacological effects really have to be understood in terms of the sociocultural norms and the individual risk factors.
Carrie, it's really interesting because when we talk about this, then that really aligns with a lot of our primary prevention work, because then we're starting to begin to think about, the norms, and that there's, work, you're going to talk about policy, and we're not going to talk about changing some of these gender norms in today's web conference, but yet those are really going to, that work in primary prevention also can be able to align with what we're talking about in being able to address IPV and sexual violence perpetration.
Exactly, and we will actually talk a little bit about some of those norms when we talk about the marketing and the advertising of alcohol, that it really kind of taps into a lot of those gender norms. But more on that in just a few. But so then the other piece, and I'm sorry, I'm trying to progress the slides in there. Here we go. Okay. So then the other theory, and the other way that we were thinking that alcohol policies could be influencing sexual violence and intimate partner violence perpetration is really at this broader socio-ecological level. So whereas the excessive consumption maybe was focused more on this individual level behavior, we were also interested to see, and there's definitely literature in the field about how it could really be affecting, alcohol might have community level effects in and of themselves through something, through many different mechanisms, one of which is by reducing social disorganization. And so social disorganization is a decrease in the social ties, collective efficacy, and community controls in an area. In other words, it's a decrease in neighbors that are knowing each other, that are able to keep an eye out for each other, and that can keep their own community safe. And so there's literature in the field. So the diagram there at the bottom, the literature in the field around social disorganization leading to increased risk of violence and perpetration. There's some literature that also suggests it can increase sexual violence perpetration. And then there's also a good body of literature that looks at alcohol also leading to social disorganization. So that can be alcohol contributing to disorganization through the density or type of alcohol outlets in a community that might be attracting antisocial people or people who are at an increased risk of committing crimes. Or alcohol outlets really increasing the physical signs of disorder through litter or public intoxication or people loitering, and that these are really have the potential to decrease social ties of neighbors or to decrease feelings of social order and social controls. And ultimately, this might increase the risk of violence, including sexual violence and intimate partner violence.
So Carrie, what you're talking, the concept of social disorganization is one that I think we don't talk about enough in looking at our sexual violence and domestic violence, because it really now is shifting us away from the individual to a real looking at our community itself and how the community contributes to it. And it's a vocabulary that we really want to be able to do. And Stephanie is asking about some more outlets contribute to a decrease in neighbors getting to know each other and keeping each other safe. It's interesting, and we'll think about this a little bit more. So I just think it's a really important concept. It's really challenging us to think on a community level, and it also creates new opportunities for us to think about our work that we'll do. So I think it's a really important contribution, and often not what we think about when we've done our sexual violence or intimate partner violence prevention efforts.
Great. Yeah. Thank you, David. And just to sort of address Stephanie's point, which is great. Yeah. I mean, I think that partly there are different alcohol outlets have different kinds of effects. And so partly it can be the clustering of outlets that are bringing in more people that don't live in the neighborhood or that don't live in different communities. So it's bringing in outsiders, it's bringing in other folks, and so it can sort of have this disorganizing effect that makes it harder for people to know who is living in their community and who's not. So things like that. But yes, okay. So I might move on if there are not other questions.
Okay. Well, great. And then and just once again, let's thank Ashley, who just posted a link to more about social disorganization theory, so people can get more information about that. So let's ask a question now. This is back to me. And so, what do you see for us as prevention practitioners? What are the advantages of using policy change to try to prevent sexual violence and intimate partner violence? So let's think about ourselves, because what we're doing is really talking about the challenge of how we move from the individual to a more higher level on the ecological model, or using more of the higher levels within the spectrum of prevention. What do you see as the advantages of using policy change to prevent sexual violence and intimate partner violence? And so I want to get from the thoughts from all of you in being able to do this. And so Laura talks about a broader impact that it can be able to have, and that it impacts a larger segment of the population. A cynical answer, which I don't want to, that it looks good to funders, and that often funders talk about it. So there is a place where we see some funders are being able to do this. We can potentially reach more people as we combine forces with our substance abuse prevention allies. And that's a great alliance that we have potential available. Bunny talks about this was a model that was used in things like seat belts and car seats for children, that works. So we have to recognize there's some differences. The mechanisms are not quite the same in stopping childhood injury, but I think that's a really good point that we've seen this. It brings it away from individual to a more community society level, has the ability to have more teeth for consequences. It can change, Donna talks about policy can change our public perceptions about social issues, and we can create more community buy-in, Stephanie talks about, and that we can be more sustainable than programmatic approaches. And Virginia talks about it then creates the opportunity of changing our social norms and expectations.
David,
yeah, go ahead.
I really like what Kathleen says. It addresses community values and engages the community in changing behavior. And to me, this gets to the fact that we're not just talking about federal or state level policy. We're talking about local policy. And that's the way that we can really make change as well.
And when those changes become, we then have an opportunity to have these discussions that begin talking about intimate partner violence and sexual violence when we look at issues. And I know where I live, the issue of alcohol, outlets availability is something that is a very heated conversation within my community that I personally live in. And so we need to be able to think about how we can do this. So this is a really interesting, great to hear so many people. I have to add Justin's comment because that's one that is a passionate heart. We then begin to overcome market-driven decisions by promoting the public good. And I think, Justin, you're referring to, that right now a lot of our decisions are made based on what market-driven, meaning like people who want to sell things are being able to help decide what's available, as opposed to making decisions on how do we best serve the community need. And so this becomes a tension, and I think this will come up later on when we talk about some of the ways of addressing policy work that Carrie and Megan will be doing this. So I'm now going to pass the podium back for the next slide and go back to you, Megan, and you're going to talk about your process of how you went through trying to identify these promising policies.
Yeah, thank you, David. So this brings us to our current reviews, and again, one was on sexual violence and one focused on intimate partner violence. And both reviews were qualitative and focused on summarizing evidence from outcome evaluations on various types of alcohol policies. Both papers, evidence was drawn from primary empirical research, but also from systematic reviews, meta-analyses, and government and non-government reports where applicable. The evidence was also identified through several different data sources, including social science, economic, and law databases, online resources, and reference lists in relevant articles. The types of outcomes included in the review varied for each paper. So for the IPV review, it focused on studies that included violence-related outcomes only. And the focus was policies that had some direct evidence of impact on an IPV-related outcome. And where applicable, if there were other studies that reported on additional types of violence, like youth violence or child maltreatment, those were included as well. The SV review also focused primarily on SV perpetration and victimization outcomes, but they also included evidence on any hypothesized mediators. So a big one here would be alcohol consumption. And then any evidence of impact on related risk factors for SV perpetration. So things like general aggression, IPV, or risky sexual behaviors. This slide shows the policies that were reviewed in each paper, with both papers speaking to evidence on pricing, sale time, and outlet density policies, and the SV paper also reporting on marketing, college-based policies, and policies that are intended to impact the drinking environment. So these are going to be the different policy areas we're going to be talking about today. So let's dive into the findings, starting with pricing policies. So pricing policies are exactly what they sound like, policies that are intended to change the actual purchase price of alcohol. And it can be done in a couple of different ways. One example is a policy that would restrict promotional drink specials. So for example, in a community, you might have a policy in place that prohibits bars from selling half-price pitchers of beer during happy hour. Most of the research, however, on pricing policies has focused on alcohol taxes. There are 3 types of alcohol taxes. Excise taxes, which are levied at a fixed rate per gallon, ad valorem, which is usually levied as a percentage of the retail price, and sales tax, which is obviously not specific to alcohol and just is a tax on goods in general. So each state looks a little different in terms of how these different taxes are applied. It's also important to note that if that wasn't complicated enough, tax rates can also vary by the type of beverage. So there's typically different rates for beer versus wine versus liquor. And they can also vary by the size of the container that's being sold or even the actual content of the beverage. So this can get really complicated really quickly. It's also worth noting that alcohol taxes haven't seen a lot of dramatic policy changes over the last 40 or 50 years. This citation here is from a report from 2000 that found that 35 states had not adjusted their tax rates at a rate consistent with inflation. So in those situations, the report suggested that the tax rate had lost about 50% of its value over time. And so as a result, the ability of these policies to impact consumption and related harm is a little bit up in the air as well. So the theory behind pricing policies, The theory behind pricing policies is that when you raise the price of alcohol, then you're going to reduce demand for certain beverages. So that would end up leading to a decrease in excessive consumption and any related harm resulting from that. And that's typically what the research supports. And the research on pricing policies generally suggests that there is a significant impact of price on excessive consumption. There was a meta-analysis done a few years ago that had over 100 studies in it that suggested that a 10% increase in the price of alcohol leads to about a 5% reduction in drinking behavior. Research also generally suggests that restrictions on drink specials, so the happy hour policies that we mentioned earlier, that are also associated with decreased consumption, although there are fewer studies that have looked at these specific types of policies. But research that specifically looks at violence-related outcomes has generally been focused on federal and state excise taxes. And for sexual violence, the results were pretty consistent. The higher the prices, the lower the sexual assault rates. And in addition, studies support the idea that higher prices also reduce sexually transmitted infections, risky sexual behavior, and other types of violent crime like child maltreatment and general violent assault rates. However, this was actually one of the policy areas where our two papers differed a little bit in terms of conclusions. There were 5 studies that looked specifically at intimate partner violence outcomes, and 4 out of the 5 suggested no significant impact of price on IPV rates. There are a lot of reasons why that might be the case, but one possibility that we think was worth noting was that 2 might relate to the studies themselves. So, for example, 2 out of the 4 focused specifically on intimate partner homicide rates, and the research on homicide rates in general don't show the same strength of relationship between price and violence rates. And then one of the studies, for example, focused on domestic violence against pregnant women only. So just some of these methodological factors may have influenced the findings.
So, Megan, and I don't think you'll be able to address this, but I just want to acknowledge the comment that was made in here, is that is thinking about the is some of the consequences of our policies, and as from a practical basis, so Elizabeth writes of does price policy propose? Do such price policies encourage college students to drink at home or at parties instead of at bars, and which might be also unsafe environments? But what I think this data is suggesting is that what we've seen by looking at it from an environmental perspective, it does create reductions in the rates. This doesn't mean that where people drink, there still could also be risks associated with different places that people drink, and the consequence of this might have impact on where people choose to be doing their drinking.
That's right, David, and I'm glad that that point is coming up, because I think it really applies to all of the policies we talk about, that there is an assumption being made about how the policy is going to work, and there is a possibility that if you increase the price of alcohol, that people will just buy cheaper brands. So that's something that we always have to factor in. It's true what you said, though, that environmentally, at least looking at these studies, there does seem to be a global effect, but when we really break it down, it would be really important, I think, for our research to dig a little bit more into these mechanisms and how these policies actually play out in real life, whether or not they work the way that we think that they're going to work, because that really is relevant to a lot of the different things we'll talk about.
Right. So I want to appreciate the really good thinking that they do, because those who are actually implementing policy, we do need to be aware of and think through how these pieces go. And be aware of what this research is suggesting as possibilities of ways that can be show an association of a reduction of sexual assault rates within pricing policy, is to be specific. Okay, I'm sorry, I didn't mean to totally interrupt, but I love it when we have great thoughts that our people in our audience have.
No, I'm glad that came up, and I think it's one that's relevant to all the other policies that we're going to talk about as well.
And I think it also just relates, this is Carrie, just really quickly, that both of our papers focus on outcome evaluation, which is both a strength and a weakness in that it has difficulty. A lot of outcome evaluations have difficulty speaking to the implementation factors that are so key in understanding how to actually implement policies or the different sort of like mechanisms by which they're working. It's really looking at the impact of those. So that is definitely a place for future research I think will be really helpful.
It also sounds like future web conferences on how do we actually do that. But we are not going to ask the two of you on how do we implement all these policies, because that is not what you studied. So go ahead, Megan. Why don't we now talk about alcohol outlet density?
Yeah, sounds good. Okay, so outlet density basically refers to the number of outlets where alcohol can be purchased, and it can be calculated per geographic area, or sometimes you'll see it reported based on population density. And outlet density can also be differentiated by whether it's on-premise versus off-premise outlets. So on-premise would refer to bars, restaurants, ballparks, and then off-premise outlets would refer to places where you can purchase alcohol to consume elsewhere, like liquor stores, grocery stores, convenience stores, and the like. There are several different types of policies that can impact outlet density. So a few of those are listed here. Privatization is referring to policies that are typically eliminating some sort of government monopoly on sales of certain types of beverages. Usually in these cases, it's actually increasing the number of licenses to sell alcohol, and so the number of outlets go up. Licensing can go either way, depending on whether the policies are more restrictive. So, for example, if you prohibit alcohol sales in grocery stores, that would be a more restrictive licensing policy. Or they can go the other way and be more permissive, so allowing restaurants to sell liquor by the drink. That would be an example of something that might increase alcohol outlets. And then zoning laws, that can also go either way. But this is one that I think is interesting because it's one where outlet density itself can specifically be regulated. So, for example, there are many communities that have implemented permit regulations that limit the actual number and concentration of outlets, and also occasionally restrict the proximity of outlets to schools and playgrounds and things like that. And then finally, restrictions on alcohol sales, basically dry counties or towns that are not surprisingly associated with a decrease in outlet density. So lower outlet density is believed to basically decrease physical access to alcohol, which could lead to decreased consumption. But like we talked about earlier on the slides that Carrie was presenting, outlet density is also perceived to impact a social disorganization at the community level through the presence of potentially more social aggregation in and around outlets, exposure to marketing, things like that. And there was actually an interesting paper that came out a few years ago that talked about this in terms of niche marketing and authoritative drinking, which I always think is an interesting way of thinking about it, that the more outlets you have, the more competition you have to attract patrons. And so then bars become more specialized. You get sports bars, wine bars, country western bars, anything that you can think of. And all of those are designed to pull in a different segment of the population. So in response, then authoritative drinking can happen, where people sort of self-select into some bars where they find drinkers that are similar to themselves. And so in this paper, it argued that individuals who may be at higher risk for violence already may congregate in some outlets more than others, and it could influence violence rates as a result. So it's just something to think about as we talk about outlet density. At this point in time, there are actually no studies that look at the direct impact of the actual alcohol outlet policies on intimate partner violence, sexual violence, or violence in general. But there are quite a few studies that looked at the general relationship between outlet density and these different types of violence. And consistently, it shows that the greater the density of alcohol outlets, the higher the rates of intimate partner violence, sexual violence, alcohol consumption, and all other types of assault, violent crime, injury, and the like. What was less consistent was whether or not off-premise versus on-premise outlet density mattered more. They were really sort of mixed, where in some cases it was the density of bars that made the difference, and in other cases it was the density of liquor stores and convenience stores. So that's definitely, I think, an area to explore further, especially when we think about the implications that it has for violent behavior. I'll pause for just a second. See if there are comments or questions.
Okay, well, I see. Once again, we are going to questions beyond perhaps where your research is, but I think policies are important, but I think it's important, it leads to pointing fingers at corporations when the issue is with the consumer. I think it's an interesting question of the balance of when do we look at the corporate policies on how they sell this, and then we look at consumers. And part of, I think, what we're talking about, Megan, is to try to think about how we can actually hold businesses and hold our social policies accountable and not only rely on individual consumers and make it very individual. So I think this really is a cause to shift and be able to look at this of what that implication is. this doesn't mean we're not talking about individual responsibility and peace, but we're not looking at the issue solely that way. So I think it's an interesting tension and an opportunity for us to think about this differently.
Yeah, absolutely. I think that's an issue for a lot of different areas of public health. If you just think about smoke-free policies, for example, it's a great example of how it does impact individuals who want to smoke at a restaurant that they're going to. But at the same time, at a bigger level, it also communicates something about social norms and the social acceptance of smoking in public around other people. So it's sort of this, like you said, a tension between both of those different avenues and how it can impact the way that we think about these issues.
And I want to acknowledge Linda's point that I think it was Linda. So many people are writing in, so I'm here. That policies is not the only factor, and not necessarily change the behavior. And certainly, I mean, we're not going to probably have a long history about talk about prohibition, but we haven't. Alcohol. There's different policies that have other implications, and it's one way of being able to change behavior, but it's also one that we need to be able to consider. But we also want to look at the developing comprehensive approaches, and what we're encouraging now for people to do is think about adding policy to their menu of things they are doing. And a policy will not fix everything. That is, no one's suggesting that, but we do want to think about, can we add it to our pieces? So why don't we now go to sale time policies.
Okay, great. So these are policies that regulate when alcohol can be sold, and they literally date back to colonial times. These policies can include, for example, blue laws that prohibit sale of alcohol on Sundays, and it also includes laws that dictate when bars have to close, for example. So policies that regulate the hours of sale, these are going to be typically things that we see vary at the community level, but days of sale can also be a statewide policy. At the time that we were doing the review, there were about 14 states that still actively restrict alcohol sales on Sunday. And the theory here is that decreasing sale time leads to decreased access and availability, which would change purchasing habits and then decrease consumption. But decreasing sale time is also believed to impact social disorganization, again, through decreasing that aggregation of high-risk individuals around outlets. Research suggests that as you extend the hours of sale, general violent assault rates do in fact increase, as does overall alcohol consumption. When it comes to days of sale, typically what's been recommended is to maintain limits on days of sale in order to reduce alcohol-related harm. Unfortunately, it isn't clear whether imposing a new limit on days of sale would have an impact, because in most cases these policy changes are going in the opposite direction. Typically the movement now is to lift these restrictions as opposed to imposing new ones. So it really hasn't been able to be studied. For hours of sale, the reviews suggest that there's a bit of a dose-response relationship. So if bars are suddenly required to close 2 hours earlier, it doesn't seem to have as much of an impact. But when you get to changes of more than 2 hours, then you start to see significant impacts on alcohol consumption. There haven't been any studies that focus specifically on sexual violence, and really only a couple that looked at IPV-relevant outcomes. For hours of sale, there was one study in Brazil that found that when they they had a pretty dramatic change of 24-hour sales being permitted to closing at 11 p.m. So that's a big change. And they found that there was a decrease in assaults against women. It wasn't a statistically significant effect, but they did see a decrease in homicides that was significant. And then for days of sale, there was one study in Sweden that found a 15% decrease in what was called domestic disturbances. They didn't define what they meant by that, but when the restriction on Saturday sales was enacted, they saw that decrease. However, when the ban was later overturned, alcohol sales went back up, but violent assault rates did not. So at this stage, there really isn't a lot of evidence to go on as it relates specifically to IPV or FB outcomes. But there does appear to be an impact on consumption and general violence, and so it suggests there might be something there, but at this stage, we really just would need more data to better understand how these would work.
There was a question, Megan, that's actually a little bit these questions are coming. So many, so I am trying to follow here. It was actually, every time, it was actually on outlet density. Did you know anything if there was any difference about impact on age groups, and if there's, if the studies had looked at different age groups, because the outlet, in terms of how the impact goes on in the out, this was around the density of the question was asked, but this might be relevant to any of these others, or if that's not a factor that's been looked at as much in the research.
You know, Carrie and I are just looking at our data, and I don't believe there is anything that, there were some studies that looked specifically at data from individuals aged 18 to 26. There are actually 4 different studies published on it. One that looked at victimization among females, victimization against males, perpetration among males, and perpetration among females. It all used the same data set. And there were some mixed findings on that. In some cases, there was no relationship, and in some cases, there was. But the bulk of the research doesn't break it down by specific groups. It's a good question, though.
Great. And then there was questions about the history of blue laws, and there's a little bit, I guess Ashley found a thing. I did not look it up, so I've always been told it was in the blue paper in New Haven, Connecticut, but maybe I am wrong. I don't know.
That's what I have heard as well, that it was printed on blue paper, and that was why they were called blue laws. So
right. So someone who has looked it up will actually say, I was having lived in New Haven, Connecticut, and not being able to buy alcohol on Sundays. That's how we were taught that and there's been a lot of questions about college campuses. And this is back to when I was in college, but I'm sure we're going to get there very soon. So let's talk a little bit about drinking environment policies.
Sure. Okay. And I'll be taking over here. So these are the policies that we covered in the sexual violence paper that weren't covered in the IPV paper. But so drinking environment policies include a number of different types of efforts that are aimed primarily at increasing the safety of drinking environments through the reduction of overservice. And overservice is service to people who are already intoxicated or who are underage. And so there's a whole host of different kinds of policies. We have a few up here. So things like enhanced enforcement, which is just trying to enforce existing laws that prohibit overservice. So this can be increasing security or police presence at bars or other outlets. There's also things called dram shop liability laws, which hold alcohol outlets liable for alcohol-related harm that patrons caused who were overserved at their establishment. So if an intoxicated person leaves a bar and causes a car accident, that bar owner could potentially be held liable for the damage caused by the intoxicated person if they were overserved at their bar last. There's also responsible beverage service training, which is training that's sometimes mandated by liquor boards. And it's training to alcohol outlet owners and staff to decrease their skills to prevent overservice. And as you can tell by the fact there at the bottom, they're definitely increasing in popularity. There are now 36 states that have policies that require urge server training programs. And then finally, we included in our review other training programs that primarily focus on things like preventing violence preventing violence perpetration. There it is. For example, this can be training that builds staff skills to prevent and diffuse aggression in bars, or management strategies to reduce environmental risk factors of aggression. There's less in general in the literature about these. However, we included them in the review because we're hearing more and more about places that are implementing these kinds of programs, and even some places that are implementing these kinds of training programs that are focusing specifically on reducing SV perpetration in bars. So there's like the Safer Bars Project in DC and the Arizona Safer Bars Alliance. So we included in the review because of this. And ultimately, we looked at these policies and hypothesized that they might be affecting SV perpetration by potentially decreasing the excessive consumption, and then also by potentially decreasing the social disorganization within these alcohol outlet settings. So within bars, if you're decreasing violence or decreasing overservice, you might actually be increasing the safety of these settings, and therefore you're decreasing the social disorganization.
There's an interesting set of questions that are here talking about, and I know that you started looking at perpetration, but there is a question that's related, and here is that we're changing policies and community norms that are, around alcohol consumption, particularly if it's demonizing alcohol consumption or making potentially labeling that as the problem, does that have any impact on victims' behavior in terms of will they seek support if there's an environment? Because we are aware of, for example, and I know college campuses, this has been an issue that many people have developed amnesty policies to address, is that people, if we're coming in an environment saying that we don't want to see drinking and victims have been drinking, they might be less likely to report, so we want to make sure we can do that. So I don't know if that's been anything that you've looked at in sort of these drinking environment pieces, and if they've looked at, and I know that's sort of outside the purview of how you've been looking at it, but it is an issue that I think is important for us to be considering.
Yeah, I mean, I think, so as part of the focus of these kinds of policies specifically, and we'll get into more of the campus stuff in just a minute, but these drinking environment policies are often really enforcing the laws for the bar owner, or for like outlet owners and staff. So it's prohibiting over-service by staff and by the bars themselves, and so it's not actually criminalizing the intoxication, but the serving someone who's already intoxicated. So there's sort of that piece of it, but I mean, I absolutely having different programs that are creating opportunities for people to be able to not feel as though they're to blame for being victimized, even if they have been consuming alcohol, is of course important, but that's less the focus of these policies.
Right. And then there's here some people have talked about training bystanders and bartenders in bystander prevention. I know there's several programs of that. And Karen is wanting to know, where do you find these policies? Because they'd love to be able to see this. And I see that Stephanie does, as pointed out, that the Boston Area Rape Crisis Center has done some bystander trainings. There's also some programs in Arizona. I know that there's many people throughout the country who have been doing these types of programs. So if you are familiar with the program, do share information about what resources or what policies that you know of. That would be great.
Wonderful. Yeah, absolutely. I mean, and part of the movement in the field is being able to evaluate these more. So, so I'll dive into that now. So basically, we couldn't find any studies that looked at the effect of these policies specifically on IPV or SV outcomes, which ultimately actually isn't too surprising, given that the goal of most of these policies is about reducing over-service and then is often focusing on drunk driving specifically. And so that tends to be the focus of the research in this area, is about the effects on drunk driving behavior. But there were some studies that looked at risk factors like excessive consumption, and the evidence there is largely mixed. So there were a few studies on dram shop liabilities that really didn't find significant reductions in consumption levels. There were some encouraging studies looking at the use of responsible beverage service training to reduce excessive consumption, and then those also suggest, too, that the efficacy of the responsible beverage service training programs is increased by the liquor boards mandating that training. So that can actually be a way to boost the efficacy potentially of those types of trainings. But one really encouraging study that we did find on a violence prevention-focused training was on a program called the Safer Bars program, which is in Canada. It was implemented. It was a randomized control trial of something like 30-something bars in Canada, where about half were trained on the Safer Bars program and half weren't. And they found that the bars that had implemented this training program had significantly reduced rates of severe and moderate physical aggression in bars, which is pretty encouraging. But again, this is just from one study, so clearly there's more work to be done. But just given based on what has been in the chat, there's clearly many different programs that are being implemented in the country looking at this. So it'll be great to be able to build the research evidence on the efficacy of those programs. But this one study is certainly encouraging. Right,
okay, so let's so now let's get, people have been asking about colleges and universities, and before we have that, I want to get some ideas from you all, because I know many of you who do work on campuses. I can, looking at the list of people. So I'd like to get a sense of what policies do you think could have impact? And I know it's already started that conversation, so let's get a sense of what policies could have impact to reduce sexual violence and IPV on campuses, and maybe campus policies that we can be able to do. And so that's important. So amnesty policies that I referenced earlier is really important. And once again, not a part of the purview of, because that's around victims of what the study was, but I think an important policy to be that's important to consider. I know I actually have raised that with the some of the people looking at this earlier. So what are some other ideas of policies? I know there were questions earlier about dry campuses, and there's and then the questions of how much those are policies and how much they are actually practices of implementation. And so just asking about, is there data on SVP rates in colleges that are dry versus wet campuses, and party policies for student organizations, designated trait bind standards that be present, looking out for risky behavior, consent education that's going to be going on. And so pieces, what about training for those who violate alcohol policies on campuses, and alcohol treatment programs and how they're going to be able to address that are some of the things that people are talking about. So let's, Carrie, I think this is back to you as you're going to talk about some of the what we have learned from some of the college policies.
Right, yes, no, this is great, and I think again, like all of the different things that are coming up in the chat are so wonderful, and just and shows the breadth of knowledge of this group, which is great. And so the research field, unfortunately, is still kind of catching up with everyone here. And so the level of evidence on these policies is limited to primarily these three policy areas. So it's the focus of alcohol-free dorms, alcohol-free campuses or dry campuses, and then campus-wide alcohol education campaigns, which are sometimes sort of a sort of campus-wide program. And so the picture there on the right is an illustration of that kind of social norms campaign. This comes from Fresno State, and it highlights, the way that these campaigns often work is that they're highlighting the existing healthy drinking norms on campus to combat misperceptions about the extent of binge drinking by students. And so we hypothesized ultimately that in addition to reducing excessive consumption, some of these alcohol policies may also be affecting the social disorganization of college campuses and the surrounding community. So some of the research in this area looks at things called secondhand effects of college drinking, which is the effects of students who attend or live in neighboring communities to universities that have high rates of binge drinking experience negative impacts of other students drinking, even if they themselves haven't been drinking. And so that these effects include things like sleep disturbances, property damage, and even physical and sexual violence. And so some of these secondhand effects then are potential indicators of social disorganization on college campuses and in the surrounding communities. But I also wanted to note, prior to diving into the evidence, that in addition to these three policy areas, many of the other policies that we've already covered also apply to college students and could have an impact. So as someone else was mentioning, I think before, that raising the price of alcohol is likely to have an impact on college students, or changing the density of outlets, especially changing the density in and near college campuses, would likely have an impact on college students as well. So it's definitely worth noting that these policies are certainly not the only ones that are affecting college students. And so then just in terms of the research evidence, I keep pressing the wrong one.
I'm sorry. I want to advance.
There we go. Okay, perfect. There it is. So just as a quick explanation, the research in this area is predominantly cross-sectional, meaning that the research is looking at the effects of these policies at only one time point. So it really can't speak to the policies causing specific outcomes per se, but it's really more about the association or the correlation with potential outcomes. And so with that said, there has been some evidence that looks at the effects of these policies on sexual violence outcomes. So things like substance-free dorms and alcohol-free campuses. And substance-free dorms here includes alcohol-free and tobacco-free dorms. But the evidence actually for substance-free dorms was stronger than just alcohol-free dorms. So that's definitely encouraging that we found that there's associations with SV outcomes. And that there's also pretty convincing evidence looking at the effects of these policies on other risk factors and related outcomes, including a decrease in consumption, and then decreases in things like delinquency and injury. And so, unfortunately, though, one of the pieces that did come up was that there is little evidence actually for the effects of social norms campaigns that there's a number of studies and reviews that look at the effects of these campaigns on consumptions and really have not found significant effects. Partly people are explaining this, or that researchers are exploring and understand this in part by the fact that the efficacy of these interventions are often moderated by the density of alcohol outlets near the university. That is, campaigns are less effective if there are more alcohol outlets in the surrounding community. So I don't know if there are questions or other things coming up about house policy, or if I should be moving. Okay, we'll just keep moving.
Let's move on to this one. I think is going to be very interesting to our audience.
Oh, okay. Is it just because Daniel Craig is on the slide?
No, it was because it's about changing social norms. Another way of addressing norms and the impact of advertising, but maybe Daniel Craig,
yes,
who's for $45 million. Yes.
The combination, yes. So basically marketing policies are regulating alcohol marketing in traditional forms of media like TV, print, and billboards, like the billboard there on the left, but then also in less traditional forms of media such as event sponsorship, product placement, and the ads on the internet. And so that picture of Daniel Craig as James Bond is an example of product placement. So for $45 million, James Bond, in addition to his signature martini, now also drinks Heineken, which presumably he drinks neither shaken nor stirred, but I haven't seen all the movies, so I'm not sure. But ultimately, the marketing policies can regulate either the content in ads or their location. So the regulating of the content usually means prohibiting content that targets minors or that lists pricing information. And regulating the location of ads can mean banning billboards near schools, or banning ads on college campuses, or ads on retail outlet windows that are facing outward. And ultimately, we hypothesize that the alcohol marketing policies could be potentially affecting sexual violence by affecting the demand and thus excessive consumption, and then also by affecting social disorganization by ads creating a visual presence of alcohol in communities and thus blight in those communities. And ultimately, despite the wide variety of policies that are potentially in this area that can regulate marketing, primarily the field has only looked at two kinds of marketing policies. It's state-level restrictions on billboard advertisements and state-level restrictions of advertising of alcohol prices. And I'm going to move forward. So ultimately, the studies of those two policies find no significant effects of the policies that restrict state-level billboards, and then have only found mixed effects of consumption or on consumption of policies prohibiting price information. But this mixed evidence on consumption is really counter to the very, very strong body of evidence showing that alcohol ads themselves in general increase demand and thus consumption of alcohol. And partly this discrepancy for why the evidence on these policies may not have shown much impact is that they're really limited in scope, and that the restrictions on only one or two forms of media may just lead to greater use of non-restricted media, thus limiting the ability of these policies to achieve overall reductions in advertising exposure. And so we did find, however, one really encouraging study in this area that did use sexual violence outcomes. The authors looked at advertisements that were targeting Latinos specifically in one specific California community. And they analyzed the ads to see which portray Latina models in sexist or objectified ways. And the authors found that areas with the higher density of sexist alcohol ads had significantly higher rates of SV, including rape, sexual assault, and exposure offenses against both Latina and non-Latina women. But they found that there were not higher rates of non-sexual victimization. So this, again, is just one study, but it definitely does suggest that sexist alcohol advertisements may be associated with increased rates of sexual violence in some communities. But we'll definitely need more research in this area to understand this a little bit better. And then I'll just keep moving forward. The other evidence on risk factors was, again, back to the billboard and the pricing information. And there was a study that looked at physical child abuse and didn't find an effect there either.
So it's I mean, there's a discussion now of what's the Budweiser ad selling that's going on in the text chat, and indeed, it's really interesting. I think it's an important piece, that study that shows that association, the association of the increased sexist ads with the increased sexual violence. And I know there's been efforts that are going on. Someone talked about Killing Us Softly. He talks about this relationship. I talk about the Dangerous Promises campaign that was really trying to coming up with codes of conduct around advertising to get rid of those types of objectifying ads. And there's actually very interesting reports. You can actually make complaints on Distilled Spirits Association, DISCUS, and they can actually sometimes even withdraw ads. So that's a really interesting piece. So we've talked about a lot. Our time is just going quickly, so we want to be able to get a little bit think about what people are going to do next. But I want to carry you right up. Megan, you give us a little overview of what we just talked about.
Yeah, I'll try to move quickly, so I want to leave some time for conversation. But basically, as a result of our reviews, just to give this brief overview, we felt like pricing strategies, outlet density, and college policies may be right for future evaluations. That the evidence that we've seen so far is encouraging, but their potential as prevention strategies really needs more evaluation. The drinking environment, sale time, and alcohol marketing approaches are also definitely in need of more data. We really just have a much more limited understanding because so few studies have looked at these policies, especially in terms of their impact on IPV and SB, but they definitely have potential. And so our conclusion was that some alcohol policy approaches may be useful components of a comprehensive IPV-SB prevention strategy. But there are gaps and limitations that are worth noting. In terms of future research, for starters, we need more studies that directly look at the impact on SB-IPV rates. It's important to note that even studies that did report rates, they typically relied on police-reported data, which may or may not be a good indicator of impact since so many incidents, as we know, go unreported. Also, many of the studies were conducted internationally, so it would be helpful to study the impact of alcohol policies domestically. And it's also important to understand how these policies are enacted and implemented. The role of law enforcement is definitely important in understanding how these things work. Also, other simultaneous policy changes that may be going on that impact your policy of interest or outcome of interest are worth paying attention to as we try to understand how these things work. And as we alluded to earlier, really more research that doesn't just look at the big picture policy impact on the outcome, but also looks at all the mechanisms in between, all those theoretical steps that may or may not be working the way that we think that we're doing. The possibility for substitution or displacement of drinking. Are they just going to drink earlier in the day, or are they going to just finish drinking in a private home? All of those things are relevant, especially as we think about how it impacts violence. So these are definitely some things that we hope to see in future research.
Well, thank you. Thank you, Megan, for doing this. Let's now move to the question for all of us, and we've spent a lot of time thinking about this. And what do you see as the prevention implications from these findings? When you look at this, what do you think about doing this? And, so I already see people are writing in, someone working in the alcohol prevention field, and this helps to think about it, sensitively address sexual violence with alcohol use. And these are discussions that, because our discussions often go to victim blaming, we have to interrupt that victim blaming, but we also need to be able to look at this. But what are the implications? What do you think about? I think one of the things that we were trying to do is to be able to do this, to think about how we can include policy within what we do, not replacing all of the work, but be able to think about what we can do. So let's think about what do you think some of the prevention implications are? So I'd love to hear from the audience and get some of the ideas from you all. That we know that the audience, and I know that this is one that requires a little bit of thinking about what we're going to be doing, but I think what we want to do at Prevent Connect is really help us really consider how we can be able to use this data and think about what our next steps are going to be. And I really appreciate going over, what do we do with, think about our coalitions with substance abuse, with coalitions, and how we can be aligning that and frame a larger and consistent message in the community in how we do decision making. And perhaps thinking about policies around advertising and marketing and a place to do that, and how that might align with some of the other work that we're doing around some of our social justice work that we're trying to be able to do, and incorporating campus student leaders in fighting social disorganization through social media campaigns and being able to do that. And so perhaps mandating bystander intervention for people who are working for servers. And there's a lot of coalition building opportunities that we can see that are available. And so, if this is a time, if anyone else has any other questions or comments, that this is a time to be able to do that. We just have a few minutes left, and I really want to appreciate the really robust discussion that we're having. And so this is sort of that opportunity to be able to do this and validating to see research about sexist ads. Something we teach kids about. Now we've got a little bit of science. I would love, so we probably should look into that study to get the actual citation. And that was actually, was that in a different country actually? No, it was Los Angeles. It was in Mount Los Angeles, in California. We were talking about that one study targeting Latino communities. So I'm trying to just remember these pieces as we are going ahead and being able to look at the work. So this is an opportunity for people to do this and keep the messages that you're sending. I know a lot of people are sending private chats to Ashley, coming up with lots of ideas, and this is something that we want to be able to do. And it's great seeing some of the ideas that people are presenting, and that we're moving forward. So with this, what can you do now? A little bit, I forgot these things. So Carrie, let's just do it quickly. I was forgetting these pieces here. We want to get moving. So let's talk about what you can do. People can look at their own policies, and there's resources that are available.
Indeed. Yep. So we have some resources here to help folks investigate what is happening in terms of their own communities and their own state about alcohol policies. So that first one is a link to the Alcohol Policy Information System, which has a lot of different information about a range of alcohol policies. It also has different state-level maps like this one that shows the distribution of policies across the state. But it is worth noting that because the focus is often state-level here, that the differences by county may not always be present, or may not always be apparent. So, for example, Georgia is listed as a state that prohibits alcohol sales on Sundays, but there are some counties here that are allowing it now. And so it's just sort of keeping that in mind. But the second one is a link to a resource through the Johns Hopkins Center for Alcohol Marketing and Use. And it's a breakdown of state preemption laws as they relate to alcohol policies. And state preemption laws basically give authority to higher levels of government to mandate the practices of lower levels of government, and that these state preemption laws can actually prohibit or restrict counties and local communities from enacting alcohol policies if they differ from the state level policies. So it's actually pretty important to understand what your state preemption laws are, to understand what barriers may be in place for enacting certain types of policies. So that state preemption law piece is definitely a key one to understand.
And I'm going to say something that maybe just sometimes we've seen that large lobbies want to put preemption laws in because they can control they are able to influence state legislators better, more effectively than doing it on a county-by-county basis. So sometimes it takes away the ability of local communities to be able to develop regulations. There's reasons for it, but it is sometimes we'll see industries that do lobby for those preemption laws. So I imagine CDC is not going to comment on preemption beyond giving the factual information. But I made a little bit more. I went a little further.
Thank you indeed, sir. Okay, and then the other thing is something that people have already been mentioning, which is the opportunity to build partnerships and collaborations and coalitions with people who are already doing alcohol-related work, and to be able to share your expertise of SV and IPV with these folks. That people doing work around youth violence or underage drinking or drinking and driving, all of these groups are doing really amazing work on alcohol-related issues, and that the opportunity to bring the lens of how to do this work in a sensitive and appropriate way with regards to SV and IPV prevention would be a huge plus to the field and be a benefit, I think, to both the alcohol work and SV and IPV work.
So people are already answering our next question. What are you planning on doing based on this information? We really want to hear. We really want people to have people influence, support, and give ideas to other people. We are a community that is trying to be able to do this work and learning from each other, and so it's really great. I already see so many great ideas that are coming in, but I only have a few minutes left, so I want to really thank today. I'm sorry Sarah DeGue was unable to join us, but she did help in the development of this program, and so I want to thank Sari. I really want to thank Carrie Lippy for joining us and Megan Kearns for being able to do this. We do have contact information that's available, so I want to thank all of you for what you have, your pieces, and really making this really robust conversation. So I'm going to quote Rachel, who said, "This webinar was great." So thank you, with, I believe, 2 exclamation points. So I really feel this is an important discussion for us to consider how we're going to be able to continue doing our work. I do want to invite you to join us at future Prevent Connect web conferences. We are about a community who's committed to being able to preventing sexual violence and intimate partner violence. We believe we can make a difference, and that by working together is a way we can be able to do this. So go ahead, please write down any other action steps, make those connections. We will be having an evaluation that will be coming out to you in about a half hour. And so that's coming up very soon. So I want to thank you all for joining us, and it's been a real pleasure having you. So thank you once again, Megan and Carrie, and thank you, Ashley, so much for co-hosting this with me. And most of all, thank all of you in our audience, because you're the ones that really bring the expertise within your communities. And this is a topic I think we want to return back to and think about how we're able to implement this and learn more from a practitioner perspective in the community of dealing with the nuances of how we actually do the implementation of policies. What are the implications? What are the pitfalls that we have to watch out for? How do we make sure that we do not allow victim blaming to become the narrative? And how do we find ways to really change our environment to prevent sexual violence and domestic violence? So I'll quote Laura, "This was awesome." So only 1 exclamation point. So thank you all. This concludes today's Prevent Connect web conference. We hope to see you online in the future.
Thank you all so much.